I was running it was December or January, and I slipped and fell on, I think it was the ice. That's my understanding. And I think that's the understanding of anybody that was around, wasn't it, ma'am?
So what happened?
You all picked me up and took me to the hospital.
It was Christmas time, so I thought he had maybe gone to buy me a present, or and the phone rang, and somebody called and said, "We think we found your husband. He had my phone number on his shoe." And so I went to where they said, and he was unconscious, and the EMS came, and he had quit breathing, and they intubated him and took him to our local trauma center. And he was there about 28 days in a coma. Everything possible bad that could possibly happen happened. He had an embolism, his kidneys quit functioning, he got C. diff, he had MRSA, he had pneumonia, you name any kind of traumatic ailment, it all manifested, and they said he probably would not live. But he was strong, and he did, and when he got well enough to leave the ICU, we went to a local rehab facility, and they kept him as long as the insurance would pay. But after the 42 days or whatever it was, they said, you have to leave. And I looked at, nobody would take him. There were no facilities that were willing to take somebody who needed the kind of care that he needed. No nursing homes, no local things at all, except for one place that we went. My daughter and I went to look at it. It was a brain place, and all the patients were tied up, restrained, and they used the veil beds, and if they weren't zipped up in the veil beds, they were restrained in chairs, and I just didn't feel good about it. And I had remembered that when he was in the ICU, one of the residents, the neurological residents, flippantly said to me, your only option is to take him to end-of-life care, and they'll just watch him and he'll die and it'll be over. But, he said, for what it's worth, there's a place in Florida that you might be interested in. And he threw out the name of FINR. And I didn't even think about it until 2 months later, and I called my daughter who was in Atlanta, and I said, could you please see what you can find out about this place in Florida? So we called on Wednesday. She put me on a conference call and talked to maybe Jim Bailey or someone, and they said, we'll send someone to Kentucky and assess your husband and see how he'll do. And I couldn't believe that they would just send somebody almost the next day. I think he came on Friday. And so he came to the rehab place and talked to Richard, and Richard was terrible. He was belligerent and confrontational and uncooperative and all the things that brain injury people are. He was textbook. And I thought, well, our fate is sealed. But the fellow that came said, we think he's a great candidate, and if you are interested, come down and look at our facility. So my daughter and I flew down here on Monday and signed the papers, and Adrian, the caseworker, and another big strong RN came, and we got Richard out of bed for the first time, put clothes on him for the first time, and they put him in a car and took him to the airport and flew here. And 24 hours later, my son-in-law drove me here, and I stayed 7 months. And Richard stayed 7 months. He had physical therapy twice a day, speech therapy twice a day, occupational therapy twice a day, and lots of rest, and lots of really compassionate, good care. Because I stayed here in Wauchula, I was out here every day. Some mornings I would come before breakfast, and some days I didn't come till lunch. And if I couldn't sleep at night, I would come in the middle of the night to see what was going on. And without it, and never was he alone. He always had someone with him. They were always kind, good, caring people. Then medically, he got the most wonderful care because there was a doctor here. So anytime his blood pressure dropped, or he had a seizure, or his medicine wasn't right, they would whip him right over to see the doctor. And then if that doctor thought he needed a specialist, they would take him to Sarasota, or they would take him to Orlando, or he saw everybody from a podiatrist to a dentist and everything in between. He didn't have any use of his right side. He couldn't walk. He couldn't take care of any of his bodily functions. But the doctor here, Dr. Villalba, said he thought that it was pressure in his brain, and that when they replaced the skin flap, the skull, that they should put in a shunt, and that might help him. Well, my neurosurgeon in Louisville said that was ridiculous. It was not. He wouldn't do it, that he didn't need it. And so we went with the neurosurgeon here and went to Sarasota in July. So that was, we were here March, April, May, June, July, 5 months. And we wheeled him into the Sarasota hospital, paralyzed on one side and not talking very much. And 24 hours later, he was sitting up in bed feeding himself and eating a Snickers.
Mary had enough sense to send me where I was supposed to be sent. And I got well pretty quickly, or well enough at least.
Absolutely. We have a good life. We travel, we take trips and do things together and go to movies and all kinds of things that we were told would never happen. And it's all because we brought him here. Absolutely.
Yeah, and I got to know this place very well because I was getting well.
Yeah, I believe if I left him in Louisville, he would have died.
So it's turned out fine.